When we think of being in hospital, most likely the initial thoughts in many people's minds are, how can we get out of there? No offense, I mean it in the nicest possible way, but it doesn't tend to be the sort of place most people want to stick around longer than needed. Hi, welcome back to the Community Pharmacy Services series. Today we're looking at the final Essential Service. It's a new one in England, one that was introduced on the 15th of February 2021. A similar service operates in Wales, but we'll go into that at the end of the video. In order for a patient to be allowed to leave the hospital safely, often they need to be discharged from the hospital. The patient came in or having already been taking some regular medicines, and when they leave, there might be significant changes as a result of their visit. Unfortunately, hospital discharge is associated with an increased risk of medicine-related harm, and this is often avoidable. This might be because of systems in place between different care settings, and the process of cross-checking and reconciling the medicines since discharge. These can often result in patients, as a result of medicine changes or side effects or interactions, being readmitted back to the hospital, the place they tried to get away from in the first place. So how can we reduce these risks and ensure that their returning to their community settings are done as safely and effectively as possible? Come on, you must at least have an idea of where I'm going with this. Yes, the answer lies somewhere within those community pharmacies that we've been harping on about for the last few weeks. The Discharge Medicines service in England means patients become digitally referred to their usual pharmacy after hospital discharge using some specific computer systems. The pharmacist can then use this information to compare the medicines since discharge to those that they were taking before admission to the hospital. The service in England involves 3 stages. Number 1. A discharge referral is received by the pharmacy. This step needs to be done as soon as possible upon receipt, but the timescale is within 72 hours, around 3 working days. The pharmacy team here will check for clinical information and any actions that need to be taken, compare the medicines since being discharged from hospital with those that were taken before being taken in at admission, raise issues with the relevant health body or GP if needed, make appropriate notes on the patient's record, and check to see if there are previously ordered prescriptions in the pharmacy and see if they are still appropriate. The second stage is when the first prescription is received by the pharmacy after the patient's discharge, and this would need to be done when the first prescription since discharge has been received, which is usually around a week to a month after the patient's discharge from the hospital. It tends to depend on how much medicines the patient already has or how many they have been given from the hospital to take home with them. The team in this step would need to take account of appropriate changes, highlighting any issues from step 1. For instance, if a prescription is received for an item that the discharge note indicated should have been stopped after being discharged from hospital, the pharmacy team would try to resolve that with the GP practice and make appropriate notes on the patient records and action appropriately. And step 3. Checking the patient's understanding of their medicines regimen. So this would be after step 2, but also when the first prescription since discharge had been received. It involves checking that the patient and or their carer understand any changes, if there are any, and that they know how and when to take their medicines, as well as other appropriate advice and support. Now, this is, of course, an overly simplified version of what's going on. There's a lot of work behind the scenes, but most certainly this is a service where the value is clear. Community pharmacy here has the role of being the bridge between the healthcare settings in hospital, back to the community, and between the patient and their own healthcare needs. All with a view to hopefully mean that there is less chance of a preventable instance of a patient having to go back into the hospital. As mentioned, this is a recent essential service in England, meaning that, subject to other considerations, it is one that is part of the main contract of pharmacies that they have to do. In Wales, a similar service has operated since around 2011 as a Discharge Medicines review, an advanced service. You do remember the difference, right? Between essential, advanced and enhanced services. You didn't watch the other videos, did you? No? I didn't think so. It's okay. I mean, the link's there if you want to click and watch the series again just to make sure you know the answers next time, but I don't know. Just click it. Go on. Might as well. That brings us to an end of the essential services in the Pharmacy Services series. I hope this gives you, albeit brief, an idea of what sort of services and value the pharmacy provides. Hopefully we'll be touching on the other types of pharmacy services in our upcoming videos, but in the meantime, thank you for watching, and if there are any questions, comments, please let me know. In the meantime, please like, share, subscribe, and hopefully I'll see you next week.